Greetings, everybody. Appreciate you tuning in to Family Solutions website. And I'm sitting here today with Cindy Barnhill, one of our counselors here at Family Solutions. And her practice is Cindy Barnhill, LLC. Mm-hmm. And so we just wanted to take some time to introduce Cindy to everybody so that you had an idea who she is if you were considering coming in to see her as a therapist. So we're going to just begin with letting you explain a little bit about your licensure, because Cindy has a unique licensure. She's actually a registered nurse, and so as a lot of people, when they are looking for a counselor, they're often looking for that licensed professional counselor or marriage family therapist or something, and I don't think people realize sometimes that there is a mental health specialty among nurses. And so can you just briefly talk about that?
My nursing career started in 1989 as a registered nurse, and in that I moved towards mental health. So I was able to specialize in the graduate program in adult mental health. So the letters are kind of confusing. It's APRN, Advanced Practice Registered Nurse. Mm-hmm. Some people may know us as a nurse practitioner, clinical nurse specialist. Right. So it's all under that umbrella. And able to do individual therapy, group therapy, marital therapy, and then I have also the ability to do medication management. So I did the prescriptive authority piece.
So someone that might already either looking to be on medication possibly or who's already on medication, you can help with that process.
Absolutely. If it's something that chemical we're trying to manage, longer term, sometimes it's, people come in to see us and they're in a crisis. And with that, you have sleep deprivation, high anxiety. So sometimes it's really helpful just to use it, as a short-term adjunct to get sleep restored and physically start feeling better. Right. And utilizing the therapy process. So.
Okay. So along those lines, Cindy specializes in trauma, and trauma is covers a large range of things. So can you tell the viewers a little bit about, a little more specifically about what types of trauma or specialties that you have in working with trauma, or treatment modalities or anything like that would be helpful for them?
Certainly. My practice just seemed to move more towards trauma over the years. And in the last 2.5 years, I've spent some time specializing in betrayal, partner trauma, infidelity, betrayal. And as you know, that process through the CSAT, the Certified Sexual Addiction Therapist certification, is pretty lengthy, but very well done. And so it really prepares us to treat clients that come in with this type of trauma. Right. But not just infidelity trauma, but as you said, under that umbrella of trauma, whether it's childhood trauma that's been untreated. So it just seems to be that that's where my area of expertise
and so is. Trauma is very, like I said, very broad, and so but one thing that I think with the certified sex addiction training that you're able to treat the relational trauma, which is a very specific focus there. But on top of that, with the other types of training that you have, you can work with loss, childhood traumas or abuse and things like that people have carried into their adult life, or maybe something that was recent that happened to you that is just troubling, and you're having trouble. It's definitely impacted you, and your body's having trouble basically healing from that.
And I'm glad you brought that up, because there's I do utilize EMDR technique, which is eye movement desensitization reprocessing. So we just say EMDR.
Right, a lot easier to say though.
But it's a wonderful technique that I've learned, started in 2010 with that, and then went through the certification process. But it's trauma focused. I've also used it for phobias. It's been very helpful in that area. But actually, you know, anyone that comes in with trauma, like you said, even if it's loss of a parent, grief, yeah, we're able to use EMDR if needed in that process
help with
too.
that.
It's been really helpful.
Okay.
Yeah.
Good. And so to kind of close out, viewers might be wanting to know a little bit about, or a common question that we often get is, what can they expect like on their first visit or the first, at the beginning of therapy, or could you briefly talk about that?
Yeah, well, first I think it takes a huge amount of courage to come in for an initial appointment.
Absolutely.
And we just try to sit down together and look at what's happening, what's currently gotten you in here, how's it impacting your life, what are the first things that we need to do, and then what are the goals that we're going to move towards together. So it's a very customized treatment plan geared on the client and their needs.
Okay.
Yeah.
And so it's tailored specifically to the individual or the couple that
Absolutely.
comes in? Okay.
Yes.
Okay.
And the one thing I think is unique in our setting is that because we have several people that are certified in that trauma, relational trauma, we're able to plug everyone in, in a very fluid
and operate from that team approach to treatment. Right?
Absolutely.
Very good. Well, I am very pleased to have you as part of our team.
Josh.
And like Cindy was saying, at Family Solutions, we often utilize each other and operate from a team approach to treatment. So it's a blessing to have you as part of that team. And so we hope that the viewers that you guys that are watching this now have got to know Cindy a little bit, and that offers you some information that may be helpful as you continue in your therapeutic journey. So thank you for tuning in today.
Thank you.